I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus.
I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Tuesday, April 21st. The World Health Organization is warning leaders that rushing to ease coronavirus lockdowns could lead to a resurgence of the outbreak, and the UN General Assembly demanded global action to quickly scale up the development of and access to medicines, vaccines, and equipment to battle the pandemic. The UN passed a resolution calling for all people to have equitable and timely access to testing, medical supplies, drugs, future vaccines. On this episode of Inside the Outbreak, we'll discuss the World Health Organization with AP reporters Jamey Keaten and Maria Cheng. The WHO has come under scrutiny for its handling of the pandemic from President Trump and other critics alleging mismanagement, cover-up, and missteps. A week ago, the president announced that the United States would halt funding to the WHO. Some health experts decried the move as ill-timed and warned it could hinder the fight against coronavirus.
The WHO pushed China's misinformation about the virus, saying it was not communicable and there was no need for travel bans. They told us when we put on our travel ban, a very strong travel ban, there was no need to do it, don't do it. They actually fought us.
Joining me today on the podcast is Maria Cheng, who is an AP medical writer based in London, and Jamey Keaten, who is AP's chief correspondent based in Geneva, covering UN institutions there. Let's start with this because my sense is people are familiar with the World Health Organization, but not necessarily clear on its role. So Maria, ideally, what is the WHO's mission and function?
Well, the WHO is the United Nations Specialized Health Agency. So they are the ones mandated to coordinate an international response anytime there's a major global health crisis. And typically that's an outbreak like Ebola or swine flu, or as we're seeing now with COVID-19. They are the only ones that have this mandate to coordinate the world's best scientists and epidemiologists and virologists, both on the research end and also to try and coordinate an active response. So that's, I would say, their most important role. And they are also the ones that enforce the international health regulations, which obligate countries to report certain health incidents if they could be construed as a public health event. So countries are required to report certain things to WHO. So they're the only ones that are going to have that information and the capacity to coordinate a response to that.
So Jamey, why did the WHO end up in President Trump's crosshairs?
Well, it's a long time coming, perhaps. President Trump generally has gone after a number of United Nations institutions or its affiliates, whether it be the World Trade Organization, whether it be the Human Rights Council here in Geneva. There's a bit of a target on its back from the White House at the moment. And the World Health Organization in particular, recently, President Trump has, in broad brushstrokes, has listed three major complaints about the World Health Organization. The first is that he says that it's China-centric. He believes that the World Health Organization has tilted toward Beijing and to the detriment of the United States. He's also said that the World Health Organization has botched the early response to the outbreak on issues such as whether or not there was human-to-human transmission, whether they had responded to the warning signals coming out of various places, in China in particular. And then thirdly, the real sort of bugaboo, if you will, for President Trump seems to be the World Health Organization's resistance, shall we say, to instituting or calling for a travel ban. And he has essentially accused the World Health Organization of criticizing his own travel ban of people coming from China as the outbreak was starting to unfold. Those are the main three thrusts of the complaint from President Trump.
And Marie, I'd ask you assess that criticism, because I've seen even people who are critics of the president who also question the WHO's utility and also its response to this crisis. So if you could assess that critique of the president's.
I mean, I think it's certainly fair to examine WHO's response more critically. There are questions around whether they should have been more explicit about how fast the virus was spreading within China in the early days of the outbreak. And certainly until they declared it a global pandemic on March the 11th, there had been pressure on them to do that for a while, which they resisted. So I think the argument could be made that they did not make it as clear as they should have how infectious this disease was. They said for a very long time that it was not like SARS, it was not spreading like influenza. We know now that it's even more infectious than influenza and spreading faster. So whether or not WHO should have made that more clear from earlier on, I think is a valid question. In terms of how they've responded to China, I think certainly it's been night and day if you look at China's response to SARS. So they have been considerably more transparent. But WHO is in a tough situation. It's a member state UN organization, and maybe Jamey can speak to this a bit more, but they are just not going to be able to criticize a member state without there being significant consequences. And China is a very powerful member state.
I would echo all of that. From the outset, there have been a number of analysts who have been relatively praiseworthy of WHO's initial response. There has been a very significant communications campaign. They have held a number of press conferences, really daily press conferences dating back to late January. So they've been on this case very much so from the beginning. One of the critiques has been, and not just from the White House, has been that they have looked past the shortcomings of China's response. So, for example, they have praised China when some of the early whistleblowers about the outbreak were being silenced or even jailed or restrained. So that was one aspect of it. They have continued to say that China is sharing information, but that in fact, some of that information is coming in slowly. So to some extent, President Trump's criticisms are accurate. The thing to keep in mind, and I think Maria touched on this, is that the World Health Organization, it's not just frozen in this moment in time. A lot of the things that we're seeing now are legacy issues from what has happened in the past. For example, one of the reasons why WHO is so resistant to seeing travel restrictions put in place between countries is because of how the world responded to the Ebola crisis in West Africa. Because at that time, they needed to have borders open, they needed to have flights going so that foreign countries, wealthier countries, more knowledgeable on health crises countries, could ferry in medical teams and aid to help respond. And so this now, resistance to travel restrictions now, is very much an inheritance of that era when they were very concerned about the inability to get aid to countries that need it. And I would just add one last thing about that. Remember that as much as the major constituencies like the United States, like China, are a big constituency for the World Health Organization, the World Health Organization also has 194 member states. It's got more than 150 offices around the world. It's got more than 7,000 people working in its staff. And they have to think not only of the big countries, but the small countries, the countries that are under-resourced. And from the very outset of this crisis, Director General Tedros has mentioned that the concern he has had is that this outbreak will hit countries that have poor health systems, and they will be just devastated. And that concern continues today.
Jamey, let me hit you with this question because the U.S. has already made one large payment to the WHO's coronavirus response fund. So when the president says the U.S. is cutting funding, when does that become a practical reality?
The short answer from WHO is They don't know yet. They are assessing the impact of President Trump's call to halt funding. They have just told me this morning, in fact, that they have received 81% of commitments to their current 2-year budget plan. This biennium is, as they call it, is for $5.8 billion, which includes $1 billion for emergencies. And the World Health Organization says that they're 81% funded. So based on those numbers alone, they've got a big chunk of it. But they say that they are still filtering through the numbers, and they haven't given us a precise readout as to when this hammer is going to fall and really have an impact. One final thing that I should mention about that is that the United States has been the largest donor for the World Health Organization for many years, and that funding comes essentially in two different types. One is what's called assessed funding, which is sort of a pro rata based on the weight and the size of the US economy. So it's kind of like dues, and it's essentially tied into its commitments to the United Nations overall. So that's a small chunk. And then the larger chunk for the World Health Organization from the United States comes from what's called voluntary funding. So this is the United States that's contributing funds that are earmarked or targeted for specific types of programs. So things like polio or cancer or various non-communicable diseases. And that money is the way that it's divided up. And so is roughly over the last few years come down to about 3/4 of that has been in voluntary funding and 1/4 of assessed funding.
The World Health Organization is recommending caution and a slow approach to reopening economies around the world. The president and some other world leaders have indicated that they are inclined to get things up and running a little more quickly. So, Maria, how should the United States take the World Health Organization's recommendations? As we mentioned, it's got a large scope here. I would imagine sometimes somebody might say, listen, one size doesn't fit all.
Right. And the WHO says that themselves, that one size doesn't fit all, and the recommendations they're making have to be considered by national authorities, and that they will tailor them to the country's specific needs. So I think in the case of the US, because obviously it's a very well-developed country with strong health systems and resources and organizations like the CDC and the NIH, and with people like Dr. Fauci advising the White House, that whatever decisions are made in the United States are probably going to align with what WHO recommends in terms of the broad strokes. I think the value of WHO's advice and guidance probably is more for the developing countries that don't have that expertise and are reliant on WHO to set those standards. I mean, you could argue for a country like the US, it's almost secondary since there are institutions like the CDC and NIH already there.
So last question, and I'll start with Jamey, but it can be for both of you. You know, we've talked about this a lot as we look through the lens of the pandemic, how a crisis is often a catalyst for change. So let's project ahead a little bit. Could the pandemic lead to fundamental changes in the way the World Health Organization operates?
I think there's very little doubt that this outbreak is going to prompt a major rethink from top to bottom about how the World Health Organization handles emergencies. This is a once in a generation, perhaps one in a century outbreak that has really upended the World Health Organization, not just in terms of the science and the medicine, but also in terms of its role in terms of public policy. One of the key things that we've seen in this case is that countries are looking to the World Health Organization to give advice on things like whether you wear a mask, whether you authorize people to go to their workplaces or attend sports events and concerts. This is way beyond the traditional remit of the World Health Organization, which is, generally speaking, a technical organization, made up of doctors and other healthcare workers who are really in the nuts and bolts of sharing information from well-versed countries to the countries that maybe don't have the same types of health systems. And so I think that there's very little doubt that this is going to have an impact on the way that the WHO is run. And we can see that from previous crises that WHO has had to deal with and the lessons that they learned from those.
Yeah, I would just add that I think whether or not this changes what happens to WHO is going to depend on the member states, because the only way the organization is going to be mandated to fundamentally change anything about how it functions is if the member states decide they want to change anything. And that might involve a really arduous, painful bureaucratic process. I think what this outbreak will do is probably change how quickly they respond in future to some things. I mean, we saw that happen after Ebola. They were heavily, heavily criticized for the very slow and inept response to Ebola in West Africa. And then when this emergency happened, they convened their emergency committee very quickly and declared a global health emergency within a few weeks of the virus being identified in China. I think what we might see in the future is maybe WHO evaluate the system it uses to assess whether or not situations are global health emergencies. I mean, the Director General himself said that it was an imperfect system because they basically have a situation where they go from zero to emergency all at once. And there's no in between. So there might be some changes in how they evaluate global crises in the future based on that kind of thing. But I don't see WHO changing into becoming a more responsive agency, like having the capacity to send in, more doctors or virologists or anything like that. They are a technical agency, and I think their role will very much remain a coordinating one.
That ties in a lot to the news of the day, in fact, because President Trump and some of his allies are calling for an investigation, a look into the way that the WHO has responded. In other words, they're essentially saying, before we provide U.S. funding, a resumption of U.S. funding, we want to have a top-to-bottom review of how WHO responded. And that will come. WHO has said that they will do that review at some point. The real question is whether it needs to be done now, where they're at the peak of an epidemic, a pandemic, and they need to be focusing on the immediate response. But there's no question that there will be a review and a reassessment of how WHO has handled this, and surely for the lessons to be learned.
Maria Cheng is an AP medical writer based in London. Jamey Keaten is AP's chief correspondent based in Geneva. He covers UN institutions there. Thank you both for joining me today. Thank you for the insight. Stay healthy and please stay safe.
Thank you very much.
Thanks.
At apnews.com, today's One Good Thing feature is a story about telling riddles. 15-year-old Sarah Schneider's grandmother has plenty of them, and in the coronavirus pandemic, she's sharing them in emails to sick children forced into isolation as they undergo treatment for cancer, blood disorders, and other dire illnesses. The Maplewood, New Jersey teen has enlisted a team of volunteers to write encouraging and entertaining emails for sick kids. Read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.